Hi, this is Dr. Singer Reddy from Empower Psychiatry and Sleep. Today, I want to emphasize what one could do when they're getting TMS treatments for depression and or OCD. As you know, TMS or transcranial magnetic stimulation is approved by FDA for treatment-resistant cases of depression and OCD. By that, I mean individuals who have tried several medications under therapy. Despite those interventions, they are still suffering significantly with these disorders. In those cases, TMS is effective. It is a non-invasive procedure. It does not have any systemic side effects like one would expect with medications. In them, one of the common things we emphasize while they're getting these TMS treatments is to have some degree of a structure in their day-to-day activities. Some of the things we emphasize are having a fixed wake-up time, preferably in the morning hours, and after waking up, getting at least 20 minutes of early morning daylight, and throughout the day, having some kind of a routine or structure. By that, I mean things like regular hygiene, showering, having if they like something like reading or some other activity, trying to cater some time to those aspects. If you're working, of course, you have some degree of structure, like you would go to work and come back at a particular time. But if you're not, then these things play much more importance in terms of doing it on a daily basis as a part of your life. Other aspects that I do emphasize is to have some degree of physical activity or exercise. When somebody is depressed, it's hard to get motivated to do exercise. If that is the case, I kind of emphasize maybe starting with 5 to 15 minutes every other day of even brisk walking, or if they can, maybe something which increases their heart rate. The exercise is known to have immense benefits in terms of mental health and depression. So the need to get some degree of exercise. And then by the time it's evening and before bedtime, one of the things to think about is having a set bedtime, having sort of a ritual for about an hour or so before bedtime where you try to calm yourself down. Sleep plays a significant part, and it has its own protective mechanism towards emotional health in terms of preventing mental health disorders. So anything to do to get good amount of sleep during the night time, aligned with circadian rhythm, is it has its own benefits. These are this structure with sleep and exercise could have substantial benefits of its own while they're getting the TMS treatments. Thank you very much. Again, this is Dr. Singer Reddy from Empower Psychiatry and Sleep.